remember that way too long. My personal gravity is very high today. I'm sorry. We'll see you.
Thank you. It is, but I
Matt?
heard that maybe that won't even work.
Yep, you got it. Okay, and I'm gonna ask you to do the same thing as she did. And I'm just gonna
I have a question. I'm Kim from corporate. Tomorrow Leslie's coming in?
Today.
Today? What time is she doing today? Because I know she's over there till 12.
Like I can look on the website. No, she.
Yeah, because my schedule doesn't show her in here today.
I know it changed.
Well, she's always been a part of Advocacy Day, and
Right,
Advocacy
but the
Day.
advocacy
Yeah.
day schedules changed.
Right.
I have her in tomorrow morning.
That's great. That's good news.
No, it's today. I think it's at 12:30.
Hello.
How much time do I have?
I guess.
Um,
Yeah.
why don't we go find Joan for Gretchen?
Is she in the lunchroom?
I don't know right now. I believe she's supposed to be here at 12:30.
Yeah. One? Okay.
Yeah, I mean we have her as the.
Just because I haven't been in, but I haven't been in person in 2 years. That I normally have like my notes next to me, and I'm like, huh.
You doing an introduction?
There we go.
No, I think it's external.
You think it's hotel music?
I think it's conference.
Do we still have the music?
It's coming from the hall.
Gotta ask them for
Yeah, can you go, Nick will go.
Oh, wait.
I think you got it. Oh, no.
No.
Okay, yeah, go ask them.
No, now it's the radio announcer.
But we'll get started.
Yeah, we'll get started.
Thank you everybody for your patience for our first session this week.
Yes. Well, thank you everyone for coming, both in person and online. Thank you for joining us virtually. I am Marissa Kazarian. I am the chair of the Pittsburgh chapter of Women in Bio, and we are so excited to be here with the Magee Summit, and so thankful for them for hosting us today. And our panel. Thank you for coming. Phyllis Farrell will be our moderator today, and we'll be introducing our other speakers as well. Thank you for coming. We're going to make this short so that we can get started as we are a little bit behind. Enjoy.
And I'm going to hold until we get the text situation sorted.
And we'll be introducing
little hard to think.
I can be bright, but that's a little disconcerting.
So that we can get started.
It's not great for the brain health either, to master that.
I'm going to hold until we get the text situation sorted.
Leave it to Phyllis.
There we go.
It's a whole new world.
We love it. Yeah, the best part about the pandemic was not traveling, and now we're traveling. We're having to figure out how to do all this stuff live again. Well, thank you for having us to the Magee-Womens Summit and organizers, as well as the Women in Bio team who brought us back. So we're thrilled to be able to be here. I'm excited to have a live audience, but I understand we have a very large virtual audience as well. And so we're going to do our best to make sure that everyone feels included today. My name is Phyllis Farrell, and I work for Eli Lilly and Company and have been involved in Alzheimer's disease research for about the last decade. But one of my passions, and I have found some passion friends in this topic, is women and brain health. And specifically today, we're going to talk about Alzheimer's disease, brain health, and the price that women pay. But we're also going to give you reasons for hope and a call to action, because when women do bound together, some of the have actually found that we can be successful in doing so. This clicker to work. I've got 2 mics going. Is that your problem? Do you need me to do something? Okay. We do have an expert scientist with us on the panel, so she'll be here to answer for us some of those questions. But just conceptually, what's really important to know is that we have made a huge amount of progress in Alzheimer's disease research over the last 10 years. And it got fun and exciting in Alzheimer's disease media this year, something you don't always get to see in the research side. However, the challenge we have is that innovation is not actually translating into clinical practice yet. And that's innovation in diagnostics, that's innovation in therapeutics, that's innovation in awareness, in things that we can do for our brains that are modifiable risk factors to help us be more resilient if Alzheimer's disease comes our way. So we really need to make sure that what's happening in day-to-day practice starts catching up more quickly with where we're headed for research. But let's talk specifically about Alzheimer's disease in women. Women compose 2/3 of the people in the United States that are living with Alzheimer's disease. And some say, well, of course that's the case. Women live longer than men, and age is the greatest risk factor for Alzheimer's disease. Well, that is a fact, that is true, but that's not the only reason that women are more impacted by this disease and differentially impacted by this disease. And we need to do more work to understand what those biological reasons are. The other thing that's important to note is that women comprise 2/3 of unpaid American caregivers. Over 1/3 of them are daughters. 4-to-1 ratio of women stepping up and taking care of their parents, their husband's parents, their grandparents, their aunts and uncles. We love being the caregivers for our families, but it is crushing. And then what's also really important to note is most paid caregivers are women. When you look at nursing assistants, paid dementia care workers, CNAs, that work population is also largely women. So this is a disease that women need to care about because it's ours. So we're honored to do this, but we're tired and we're broke. So one of my favorite quotes is from Doreen Rentz. She's a PhD at the Harvard Medical School. And she recently reviewed an observational study, and her takeaway was clearly, memory loss in a loved one is not a benign event because the healthcare utilization of the caregiver goes up right alongside the patient that they're caring for. 63% of caregivers says that caregiving is moderately or highly stressful. And if those are women, that number is probably understated because we know we don't like to complain. $7,000 per year women are paying out of their own pockets to care for a loved one. And 44% of our adult life, we step out of the workforce. This is one of the things that frustrates me to no end. We've made so much progress on gender diversity in the workforce, and we can walk all that back with this disease if we don't find a way to support caregivers better. What does that mean financially? This is a report from Merrill Lynch, Bank of America, and it actually shows the cumulative lifetime earnings differential of a woman who takes time off to care for her children, her parent, and her spouse. It's over $1 million per individual in the net present value of lost wages. We're living longer, but we don't have the resources that we need at end of life. Both our own and these work hiatus also pull us out of the Social Security plans. But where's the hope? Women are the catalysts for change. Look back in history. I think you'll often find it was a group of small group probably, strong, committed friends who were the catalysts for that change. We faced the greatest health challenges during the height of our careers and the greatest caregiving challenge. But we're the agents of change in our families, in our communities, in our countries. We're the ones that put the fundraiser together. We're the ones that make sure the family that's fighting cancer has meals. This is what we do. We do it naturally. It's the way we're wired. And within the hearts of women lie the solutions to some of the most global pressing challenges of our time. So what are women saying about brain health? Probably why you're here. I'm preaching to the choir. Most women are concerned about our brain health, but we don't talk about it. We don't talk about it with each other. We don't talk about it with friends, and we certainly don't talk about it with our doctors. Most women, 70%, actually express interest in learning more. We want to take care of our brains. We take care of everything else in our bodies. And 90% of women agree that taking care of our brains is just as important as the rest of our body. And 80% say we should be talking about brain health more. One of the things I often ask women is, if you found a lump in your breast and you went to the doctor and you told your doctor that you found that lump, and the doctor said, let's give it a year and see what happens, what would you do? You'd find another doctor. So why aren't we doing that for our brains? We can and we should. And I've got a group here today that I can't wait to introduce you to, because you're going to come out rocking and rolling and ready to take on this challenge. Okay, so I think I'm switching to lavalier. And I'm going to start here with Beth. So Beth, would you do me a favor and just, actually, let's do some intros real quick so everybody knows who everybody is, and then I'll jump into questions. So Beth, will you introduce yourself, please?
Absolutely. Hi, everybody. I'm Beth Chaban. I'm a visiting assistant professor of epidemiology at the University of Pittsburgh Graduate School of Public Health. I'm also affiliated with our local Alzheimer's Disease Research Center at the University of Pittsburgh. And my research specifically looks at sex and gender differences in small vessel disease in the brain and Alzheimer's disease.
Thank you. We're so glad you're here.
Thank you.
And that you color coordinated. By the way, our strategy today is to have you all feel like you're just joining our little lunch group here. So hopefully you'll find that this is fun and engaging. So Meryl, would you introduce yourself, please?
I'm Meryl Comer. I'm a co-founder of Us Against Alzheimer's and chair of the Global Alliance of Women's Brain Health. I'm here on the panel because I was a 24-year caregiver for my husband and my mother with Alzheimer's disease. And I survived, ladies. It is possible to come out the other end.
And you're a terrific advocate for all of us. Brooks.
Hi, thanks so much for having me. I'm Brooks Kenny. I am the executive director of the Women's Network at Us Against Alzheimer's. We are a patient advocacy group really dedicated to conquering the most challenging obstacles in this disease, and we know early detection and diagnosis is among them. I run several of our consumer-facing campaigns, which I'll share more about during the discussion today. I also was among the women that Phyllis mentioned when my mother-in-law was diagnosed 3 weeks after I began this journey at Us Against Alzheimer's. It was me who raised my hand and said, maybe I need to step back in my career. It was me who put together the plan for our family to support our mother-in-law, and I did it gladly, without resentment, but it is true that we fall into that role, and so I bring both my professional point of view, but also personal passion to this work, and really thrilled to be with all of you, and thrilled to be in person somewhat. I mean, this is doing wonders for my brain health right now. So
That's right.
Thanks for having me.
I think actually, and sometimes I start these presentations asking people if they've been impacted by this disease. Obviously, when we're hybrid here, it's difficult to have people to raise their hands. But it's very seldom that I get out of a presentation without 70 or 80% of the hands being raised when it comes to Alzheimer's disease and dementia, whether that's in your own family or a friend that you know that is caring for someone. And I think that's a really important thing for us to realize. This isn't a rare disease. This isn't an orphan indication. This is a disease that's impacting families around the globe, but even here in our highest resource countries, it's financially devastating. My sister actually quit her job to help my mom take care of my dad until he passed away. And my mom's health declined significantly in the process of taking care of my father. And that was even, at the end where we had full-time care. We're a family that could do that. I get concerned about families who can't do that. How do they make this work? So let's jump into some of the questions that I know are out there. There's also the opportunity for questions to come in both live here as well as through the virtual platform. So please type in your questions and I'll definitely catch those. So Beth, can I start with you?
Sure.
So talk to us about gender and sex differences in Alzheimer's disease and what we need to know.
Sure. Well, you set me up very nicely for that because you mentioned that statistic that about 2/3 of the people with Alzheimer's disease in the United States are women. And that is something that is typically found. So the prevalence of Alzheimer's disease, how many people have it at any one given time, does seem to be higher in women around the world. That is partially, though, because women live longer and age is the strongest risk factor for Alzheimer's disease. However, when people do try to tease this apart and understand a little bit better whether it's only that, they look at a couple of other things. And so one thing they look at is something called selective survival bias. This is the idea that maybe the men who come into our studies when we start to look at them when they're older are actually healthier than the women, because men are likelier to die at an earlier age of cardiovascular disease. So now we're comparing men who are healthier by the age of 65 to women who are typical agers at the age of 65. And it's possible that this explains about 20 to 50% of what we see in the difference in risk, the sex difference in risk. But it doesn't explain everything, obviously. And so what Phyllis pointed out, that there are still these other factors that we need to know about, is very true. And so there are biological factors and there are sociocultural factors. And so that's where gender comes into play. So sex is things like chromosomes, XX, XY, hormones, reproductive tract and issues associated with that. But then gender is a sociocultural construction. And so it's normative behaviors, the ideas about what a person who is born as a female should be and is doing. And those can affect things like whether you get highly educated or not, whether you do enter the workforce and attain a high occupational attainment, as we would call it, or stay in the workforce for your whole life. We know that those things are protective for the brain, and women are disproportionately not experiencing them purely because of our gender norms.
No, it's really insightful too. I was at a meeting last week. We had a big Alzheimer's disease meeting last week, and the ADNI group, which is an academic group, got up and talked about the real world evidence study observational study they run. And their average years of education was 16. 16. And I was like, wow, that's a lot of education on average. And so you do wonder, am I even getting a representative sample? But I know that when we often talk about brain resiliency, we put in years of education as one of the things that we see pop. And you do have to wonder, is it actually, how much of that years of education is real if we're really studying people who have had, lots and lots of education? Do we have enough of a spectrum?
That's a really good point. And of course, as an epidemiologist, I love that point. So the people who come into specialty research centers because they're reporting a memory problem are different than the people who live out in the community, the average people. And so that's a really good point, that actually in the community, people don't have an average education of fully college educated, or sometimes you see in these tertiary care centers, specialty centers, that it could be even higher, graduate education. And I think the other thing that I'd like to point out, because COVID has really made us very aware of just how global and interactive our world is, that there are differences that are really important to keep in mind across low and middle income countries versus high income countries. And so a lot of the things that we're going to talk about today, if there are disparities in the high income countries, they are amplified in low and middle income countries. And so when Phyllis says something like, 66 or 60% of the caregivers for people with Alzheimer's disease in the US are women, that's amplified in low and middle income countries. It's more like they're providing 77% of the care. And so I think that's an important thing to keep in mind in terms of representativeness, and I encourage all of us to think globally as well.
I love that. I also love the fact that it's something that unites us around the world. You can find women in any country in the world, and they're still the chief medical officers in their families. And so I think that's also something neat that makes me feel like I'm part of really a big group of women that can work together in this battle. So Meryl, you talked about your 24 years. Meryl probably won't say this, but for any of you who are interested, Meryl actually wrote a book called Slow Dancing with a Stranger, which chronicles her journey taking care of her husband. It's a beautiful, beautiful story. My mom and I read it when we were caring for my father, and it was very, very relatable and very, very courageous. So thank you for telling us that story. But tell us, 24 years since this journey started for you, what's the SparkNotes version? How have things changed? Tell us how much better things are now.
Well, you brought up the book, but let me just say that I didn't give advice because I didn't know if I was going to wear out in the process. And I didn't think that was fair. So I was really just upset that they had prepared us for a disease that was not a little old lady who couldn't remember her address, but the cruelest of diseases. Now, married to a doctor, chief of HEMONC at NIH, so go take a doctor to a doctor, observing behavior. So back then, the disease was so steeped in stigma that you could not really talk about it. He was too young, spoke 4 languages, long distance runner. He maintained his brain, and it just didn't matter. So he was misdiagnosed for 5 years, and each time try to get a doctor to a doctor. And what would happen is, as a doctor's wife, I would present actual typed notes of observations, and then the doctors would say, no gross abnormalities, get off his back. So then I became the target. Now, no one in those early stages thinks of themselves as a caregiver. You are a wife, you are a daughter, you are running interference for a situation, and you are trying to make it look as normal as possible. And those things just don't happen. So the stigma has changed. My great concern is that it is now trending younger because of earlier diagnosis. So you have people in the workplace who are now saying, well, I don't want to know because it might jeopardize them or marginalize them. And we have to get over that. So that's another big point. The other thing is early diagnosis. Doctors do not want to diagnose because there's nothing to treat. And what happens, again, in that scenario is 50% of people, even today, go undiagnosed. And smart people hide out. So you take a loved one, and I see someone in the back shaking their head, you take the loved one and they're on stage. They are performing for the doctor, and you walk out and say, well, that's not what happened at home. It also really just can either destroy or bring a family closer together. So I think just these are some of the things, and the economics. The economics, I was 48 years old when I had to leave my work to take care of my husband. I was told he was too dangerous to come home and no facility would take him. So I literally brought him home, weaned him off of 16 Depakote, 4 Ativan a day, and made it up as I went along. And I'm here to tell, but it was quite a journey. So.
Well, you're so generous and courageous with telling your story, but I love the fact that you brought up that doctors don't want to diagnose because they think there's nothing they can do. I was on a panel with Dr. Howard Fillett from New York City, and actually we had a large healthcare system on the panel, and that's what this vice president said. She said, well, you know, there's nothing they can do. They'll diagnose when there's something they could do. And Howard's hands went his head. He goes, I've been practicing medicine for, and I don't remember what he said, 35 years, something like that or more. And he said, I've never found a patient that I couldn't help.
Yep.
And you know, the stories that I think of are, I was at my son's basketball game, and one of his friend's moms came over to me crying and said, I need to talk to you. And I was like, oh God, what has Jack done? You know, that's my first reaction, is he's my little spicy one. And she said, I got a call last night from the police. My mom was wandering. And she's now over at the hospital. And I've got 3 days in the hospital before I have to find a bed for her, a Medicare bed. She's a single mom and a nurse. If she doesn't work, she doesn't get paid. If she doesn't get paid, she doesn't make her house payment, and her kids don't eat. And now she's sitting there with 3 days to resolve a situation that's probably been 10 years in the making, because her mother did not go to sleep without Alzheimer's disease one day and wake up the next morning wandering. That is a supreme failure of our healthcare system. And it's families, and she's what I would call a good, solid, middle-class family. But that's a family now that's in a financial predicament that was completely avoidable. So I'm thrilled that you bring that
But
up.
I just want to take issue with your $7,000 a year out of pocket.
You think it's a lot more than that?
Let me tell you, if in fact you have a loved one that has any behavior issues, double that. Double that figure, because a facility you'll have to have private care. Even at home, I did a 12-hour shift, 7 days a week, ran the team. Forget those costs. Yearly, it was costing me $160,000 out of pocket to manage 2 people at home with the disease. So I don't want women. I bought a long-term care insurance policy when I was 50 because my husband had no insurance. Medicare does not pay for long-term chronic disease. Everything is out of pocket, ladies. My second policy I bought at 62, standing up at a lectern, giving a speech, and I said, if there's a lady in the audience who's been hounding me about insurance, I'm about to turn 63, I'll buy it today. So those costs, the reality of those costs, is why today they're not even writing long-term care insurance, because it is the biggest payout for insurers.
No, I think you're right. I think that $7,000 number is a general caregiver number
but
across
it's a
disease
trap.
states.
It's
Because
a
I
trap,
do think,
wasn't
I
it?
kind of looked at it and went, But I think it's also, that's the direct out-of-pocket cost versus someone who says, Brooks, I'm just going to quit my job, and I'm going to do this full-time and nothing else. And that's where I think you see the burden lie on that family caregiver. I heard a great quote the other day, which is the standard of care for Alzheimer's disease is the unpaid family caregiver. And it still is. That was the case when my grandparents were taking care of their parents. And today, still, that is the situation, which I think is one of the reasons why you see this great push for things like family, paid leave for family caregiving and things like that. So Brooks, you talked about the organization that you're running, and you guys had a hypothesis that women would jump in and take a hold of this. Is it working? You wanna tell us a little about it?
Shocker, right? I mean, absolutely. And I really want to take this part of the conversation and flip Alzheimer's on its head. And I mean that. And I don't mean that to sound cute. But we had a hypothesis that women could change the narrative, that women could actually change the conversation. Women are the chief medical officers of their families. I don't know who actually coined that phrase, but we all use it in our women's network, and we keep repeating it. And I want each of you to repeat it in your conversations at the water cooler, at your kitchen table, with your girlfriends. And we said, let's actually do the research, because we're not just going to be able to say, we know this is true. So we surveyed women across the country between the ages of 35 and 75. And what we found was they didn't want to talk about Alzheimer's. They would prefer the term brain health. Also, not too surprising. But interestingly, brain health sounded really important to them, but they didn't know what it meant. They wanted to raise the topic with their doctor, but they didn't know how. Losing their memory was their number one fear, but they didn't know how to prevent that. So we created a campaign, a pilot with women called Be Brain Powerful, and the purpose of the campaign was really simple. It was to increase knowledge among women, 40 plus, about the steps they could take for their brain health. And so every day for 30 days, you can still sign up today, we send you a very simple tip. We're not trying to scare anybody. We're actually just trying to bring people in to the conversation so we can build on the education from there. So every day for 30 days, we send them a brain healthy tip. We survey them at the end of the experience at 45 days, and then again a year later. And they told us, I feel more confident about my brain health. I feel more confident raising the topic with my doctor. We gave them tips on how to do that. It isn't easy. If you have 15 minutes with your doctor or a nurse in your annual visit with your OB, that for many of us, that might be the only doctor we see, depending on our age, for a while. So how do you bring it up in the midst of those 15 minutes? And so we try to empower women to do that. The results were so successful that we've now taken the campaign results and built out a larger movement across the country, serving men and women and empowering them to actually start taking memory questionnaires, learning about what they can do to take care of their brain. From our perspective, early detection and diagnosis isn't happening, and it's so complex, and we know some of the reasons why. As Meryl said, providers don't want to diagnose. As your panelist said, there's nothing I can do. Well, there's actually 243 studies right now on prevention, right? If we were diagnosing cancer at stage 3, like awesome, stage 3 colon cancer, no. The patient advocacy community would be up in arms. All of us women and men in the room who appreciate you being here, would be like, this is ridiculous. We need to diagnose early because Alzheimer's disease is not, I really want you to get this in your brains. It is not an older person sitting in a dark room, peering outside the window in a wheelchair with the curtains drawn. That is not Alzheimer's. People live for decades with it. If we get to people early and get them the support that they need, everybody can do better and live better. And so brain health needs to be our pathway to start those conversations with ourselves, with our families, with one person. If you have one conversation, that's a win in my book, as a way to get started.
So My Brain Guide, you guys got that right, mybrainguide.org. It's in the slides. But what's the uptake been? So you put this thing out there. What's the reaction?
Yeah, I don't mind saying it brings tears to my eyes. We launched a platform. It's free, available in English and Spanish. We worked with medical experts and Amazon Web Services to kick it off. We've had 155,000 people take a memory questionnaire. We give you tailored resources based on the answers you provided. 80% of the people are taking it for themselves. So you can take it for yourself, or you can take it on behalf of a loved one that you see often. We're using validated instruments that we've adapted to be used on the web, or you can call a phone number. And 80% of people are taking it for themselves. 30% of those people are getting a poor score. So we give them, here's what you need to do next. Here's the next step in your journey. We're not giving them all the steps, you just have to take that next step, right? Of those that are taking it on behalf of a loved one, get this, 90% are scoring poorly, meaning by the time caregivers are finding mybrainguide.org, there's already a problem in their family. So our objective is to get them to support services as soon as possible. So we're only 8 months in, and we're reaching hundreds of thousands of people.
The other point is for all of us, and if you've lived the disease up close and personal, then you're changed forever, is you want to stay healthy until the science catches up. That's the goal. You really want to push that out. So whatever the age, the advice we all know, but we've got to find time and we have to make that happen. So that's, to me, the power in the Brain Guide, and privacy online, checking yourself. Not a public explanation, just keep it, and you do that automatically.
Oh, we do it right here all the time, right? Like, I know my blood rate, or my breathing rate, you can check your blood pressure. I mean, we do this all the time right here, so why not? So what's your
I want
reaction?
to jump in and
Yeah.
amplify a little bit, because this is really, really great information. I mean, I think there's a thing that happens when people are younger where they're like, well, I have all the time in the world. I don't need to take care of my health. I can eat however I want. I don't need to work out, and all of that's fine. But actually, you really do need to take care of that starting from an early age. We know that midlife risk factors, cardiovascular risk factors, are strongly related to late life brain health. So for example, if you have hypertension in midlife, that's more strongly related to poor brain health in late life than late life hypertension. You have to start taking care of it now for everyone in this room. And we need to get that message out that there are things you can be doing. So I always like to think of it as heart health. What we all know about heart health is brain health, because I study the cerebrovascular system, so I'm a little bit biased, but you should be taking care of those things. You should be being physically active, managing your hypertension, managing diabetes, trying to prevent those things and controlling them, and do it now.
So to both of you,
This is where I get my mom lecture. It's coming. I get it a lot, but you guys can see it publicly.
no, to both of you, so this whole issue of being in control and smart people hiding out, how do we manage that and help women blow past the stigma? If all of us are engaged, I think that's the only way we blow past the stigma.
Well, I think there's a top-down and a bottom-up aspect. I think talking with our girlfriends about brain health is absolutely the number one, probably most important thing we can do, right? Because we know that when we're all talking about it, we realize we're not alone, it's safe. Well, what are you doing for your brain? You know, we talk about other things, right? How'd you lose weight? Or, you know, interestingly, we don't talk about finances. That's another interesting women discussion, which I wonder if those two things are related when you start talking about caring. I also think we advocate. Do your elected officials know that you think brain health is important? Early detection and diagnosis. Did you know that some of the biggest problems here in the United States are simple operational challenges? We don't have a billing code to make it happen.
Caregivers are not even listed on the EPIC system. We don't exist. So
Caregivers are not in the system. You know, we had the annual Medicare wellness visit actually requires a baseline cognitive assessment. It happens 4% of the time in the US. 4. And so why are we not saying, jump in, we can advocate, go ahead.
Well, in primary care, am I right that you can use observation?
How's your memory is
Right,
sufficient?
you don't have to actually do a test, you can use observation, but most primary care physicians are not trained in that observation. And I see a comment from the chat who's watching virtually, a family physician, his or her annual exam for adults includes the mini mental, and he or she is saying, can we use that? And I say yes, and we say yes, and that's why it's going to take all of us. I mean, it sounds really simple, but that's why even with Brain Guide and our Brain Health Challenge, we know from research women didn't know how to ask for that. I mean, I'm sorry, I'm building on your breast cancer example, but if you were to go get a mammogram at 50 and the radiologist said, oh no, you don't need one yet, even just actually getting the test, you would be like, no, it says right here from the US Preventive Task Force, I'm supposed to get my screening. And so the system's broken today. We need providers to be educated, we need them to have incentives and codes to actually do the work, but we have to create consumer demand. This problem is not going to be solved until we all stand up and start advocating, as Phyllis said, so as we're all saying, but we really need to be part of the solution as women.
But respectfully, there'll be millions of people who will have this disease, who will need care. And that's what the focus needs to be. And I must tell you, more and more men today are now primary caregivers. If you meet a young man in his 50s, and they're young, anybody 50 is young to me right now, they will have charts on themselves it's like the quantifiable me, because they fear what they've seen. And I think we need to take care of those, and we need to do a better job. COVID taught us a great deal. For everyone in this room or out there, you know what happened with the isolation of COVID, the stress levels. That is the daily life in that Alzheimer's environment. And that's why caregivers are in fact 6 times more likely to get incipient dementia themselves due to the intensity of care. It's like a post-traumatic stress. You are there 24/7, hypervigilant. And I don't think people really appreciate that level, but you felt it with COVID. I think everyone in the room can relate to that.
We all appreciated our teachers and we appreciated our caregivers, right? Through the pandemic, I think we learned a lot. Beth, let me ask you to build on another piece here, which I know Meryl's going to want to jump in on the research side too. But you're affiliated with the ADC here. Research, participation in research from an Alzheimer's disease perspective. You know, Lily does a lot of research in Alzheimer's disease. I've never had an individual come to me and say, wow, I wish I'd started in that clinical trial later.
Right.
You know, they're just these, and we see this in cancer, right? We see where, you know, the option to participate in clinical research is actually a care option. What is your thinking about research participation? You know, I know that it's one of the things that slows down our treatment development, but what do you see being on the front line with researchers?
Well, so research that's really, really advanced and high level is sort of adds to this bias that we were talking about before, in the sense that the people who have access to that are people who live near universities with advanced research centers, and they're the ones who have access to come into centers like that. So to the extent that these research centers can pull in people from outlying areas, provide transportation, various creative things like that, they can pull in more people. I think that this is a really important thing. You know, women need to volunteer for these studies, both as caregivers and as patients, because often for these studies, we require people to come with a study partner, because that person is so critical. I mean, you've heard from Meryl how much she knew about what was going on with her husband. They're just so critical to the reporting. And so people participating in that way is really, really important. I think that I've seen recently that, you know, while women tend to participate more in research than men, it's not at a representative level to what's going on in the population with how many women have Alzheimer's disease. So that's really important. If you're interested or know somebody who is, for people who don't report any memory problems, we can accept those people into the research center, but they need to be 60 or older. So you can go to www.adrc.pitt.edu, and you can look around on there and see how to volunteer just for the general research. And you can also see what kinds of clinical trials are being run at the study of experimental medications, or there are always other kinds of studies happening as well.
No, I think it's great. I think one of the things that is broadly misunderstood is there's actually clinical trials for pretty much everyone. At least over the age of 50, cognitively normal, cognitively impaired. Obviously, you guys have a wonderful center here that you can tap into, but clinicaltrials.gov has a list. The Alzheimer's Association has Trial Match. If you're interested in Lilly trials, we have Lilly memory trials. We're actually trying a decentralized trial right now to tackle some of the problems that you just mentioned about logistics. And specifically, you know, can study partners attend via telehealth?
That would be
because
great.
Sometimes people can't get paid time off to participate.
Right.
So we have a great question that came in from the audience, and I'm going to have you tackle this one, Beth. This is, what's the difference between dementia and Alzheimer's disease? Because this is something that in the US, and actually even globally, these two words sometimes get used interchangeably.
Yeah, so this is always what I lead off with when I'm giving any kind of presentation out in the community, because it's so confusing. So dementia can be any disease that is outwardly observable symptoms that cause a change in thinking, cognitive ability, behavior, like some of the things that Meryl was talking about with difficult behaviors. That's a change from baseline. Like that person used to do better and now they're doing poorly. Dementia, though, is an umbrella term, and it covers a variety of conditions. And so one of those is Alzheimer's disease. And things have gotten a little bit more confusing recently because there's a push in the research world to really use the term Alzheimer's disease to talk about the changes that we see in the brain, the abnormal proteins that are accumulating, amyloid and tau. So we're using that term to talk about the pathology, the bad changes in the brain. But we used to use that term to talk about the clinical syndrome, the observable outward changes that you could see if you talk to the person. And that's very confusing. Now what we've started to say is Alzheimer's disease dementia when we're more certain that it's due to abnormalities with amyloid and tau. But there might be other dementias as well. So there's vascular dementia. So if somebody has a lot of vascular disease in their brain, that can cause a dementia. Frontotemporal dementia, where the problems we see are generally a lot of atrophy in specific lobes of the brain, the frontal and temporal lobes. It very much affects behavior and language. And dementia with Lewy bodies. And so if any of you followed the Robin Williams story at all, that it turns out that that's what he had. And so these are sort of a pathology that's similar to what we see. It's the same change in the brain that we see in Parkinson's disease, but it really affects much more the outward cognitive abilities and behavioral abilities to stay awake and pay attention.
I love that you gave us this kind of framework of dementia being this umbrella term,
Right.
which is really about the late stage of the symptoms. You know, if we come back to that concept of we've had this mental model of Alzheimer's disease as a very, very late stage patient, which is why you could use the word dementia, because that is that syndrome that you see. And then Alzheimer's is one type. You know, the pathology is probably one of the biggest successes that we've seen in the research. Up until about 10 years ago, we actually couldn't see amyloid and tau in a living brain. Someone had to die and donate their brain to research and have it autopsied to be able to really get an Alzheimer's diagnosis. But now, due to the advent of imaging agents, actually the first one developed right here in Pennsylvania, yeah, actually right here in Pittsburgh, is really exciting because what it taught us is that the pathology in the brain starts 10 to 20 years before symptoms. And that's another reason why we just can't wait. And now that advent is moving into other types of biological markers. But you're right, we're in kind of a confusing time right now.
Mm-hmm. The other thing is the risk factors, and we should talk about the Latino population and Black Americans population, because they are twice as likely to get the disease themselves, but it is really the issues that you pointed to earlier. There are a number of risk factors that really set you up for dementia. Beth, I'll turn it over to you.
Certainly, social determinants of health, right?
This is critical, and why you start early, going back to
diet and exercise. And nobody's said the big one yet, and we'll give you a list of these later. But Brooks, what do you always ask people when you do this presentation about what they did the night before?
Oh yeah, so show of hands, who got a good night's sleep last night? Okay, keep your hands up. When you woke up, did you think, wow, that was good for my brain health? Did anybody? Just 2 or 3?
I did.
4 or 5.
Those of us on the
And this is what we mean, where we have to do a monumental shift in how we're thinking about our brains. Our brains are in charge of everything. They're our most vital organ, yet they're the least talked about thing in our conversations, right? And so I'll admit, my kids are getting tired of me saying, after we eat salmon, you know that was good for your brain. My 15 and 17-year-olds are like, Mom, we know that was good for our brains. But this is what we really need to do, is start thinking about and talking about our brains in healthy ways so we can reduce the stigma. And so we're more likely to talk about changes when we see them, and much earlier than we have to date.
Sleep is one of my favorite things to
huge.
talk about when I'm with a group of women, and it's one of the reasons why I'm real excited about the Magee-Womens Research Summit and why you all invited us to be here. Because when I talk to a group of 45-year-old women and I tell them that they need to sleep 7 to 8 hours a night, they all laugh at me.
Yep.
And I say, I don't care, look. You leave the dirty dishes in the sink, you tell the hubby he's gonna fold the laundry this time, and you let your kids' room be dirty before you go to bed. But the most important thing that you can do for your brain is to get that sleep. It is the way that you not just decompress, but it's your brain janitor time. And I think when I think of the 45-year-old woman who's often taking care of her parents, taking care of her kids, working full-time, probably in a dual income situation, and we've seen the data from COVID, even during the pandemic, we took the lion's share of the work. And that's great. We want to be those super women. But the only way you can do that is to put your own mask, oxygen mask on first, and that's getting that good night's sleep.
And just to amplify a little bit what Meryl was saying, because I don't want it to get lost. I think it's critically important. So there are groups in the United States that are at increased risk of dementia, and we really, really, really need to make sure that we understand why that is and change it and make things better for everyone. Brain health equity is so critical, and it's really the reason why I even got interested in women's brain health, because I want to make sure women are well taken care of. And the same goes for Latinx and Black and African American people. And the thing to remember with something like sleep, you know, if you think about sort of the way that we've designed our societies and the structural racism that's built into institutions and neighborhoods, you know, some of the new things that we're finding might be risk factors for poor brain health are differentially distributed by race or ethnicity because of things like redlining, because of the history of where people were allowed to live, because of the income that they had. And this is affecting Latinx and Black and African American people more. So I think things like exposure to fine particulate matter, so you know, pollution, that's not equally distributed, right? Who lives near the Clairton Coke works, right? It's people probably who can't afford to move if they wanted to. I think even something like sleep, if you're stressed or you don't have the opportunity to go outside because your neighborhood isn't safe to go do physical activity,
Or
you're not going
working
to
three
sleep as
jobs
well.
to
Yeah.
make ends meet.
Exactly.
You're caring for a grandchild.
Yeah.
The social determinants of health are real.
Yeah.
You know, the prevention paradigm finally connects the head with the rest of the body.
Right.
So that dynamic of our autoimmune system, everything is connected. I'm not sure, except in budgeting at the federal level, why the head got disconnected, but it has. I do want to flag, there is a short window of opportunity for those who have a loved one and you're concerned about them. The reason early diagnosis is important is they have to put their affairs in order while they still can. And that is critical to women. You must make that happen in some way, because again, once that window is closed, it creates both financial issues for you, it creates just management issues, because we're central around the individual. So I really wanted to, I'm sorry, I just wanted to flag that because it's really, it's so important to women.
We had to send chaperones with my mom and dad to the doctor because my mom would be like, it's all fine. And we'd be like, what are you talking about? But she didn't want to embarrass my dad in front of the doctor. Right. And so these were really, really difficult things. And I think if we'd had some of those conversations, my dad would have been able to direct some things that he wasn't able to because we just didn't have those conversations.
Would you like a funny story?
Yeah, bring it. Well, I'm going to let you guys give him a pep talk for this last slide.
We wanted to be keep things as normal as possible. That's the goal, and protect a loved one's dignity. So I tried to travel with my husband. I bathed him, shaved him, dressed him. I looked like hell, but we're walking through an airport, and then I have to toilet him. And there's a long corridor at Reagan, and seats look, face right into the hallway. And I took him into the family bathroom. I came out and there were a bunch of men staring. And I said, I think they think we had a quickie. Which was the furthest. Do not, when you are traveling with a loved one, just be sympathetic. If you bring a loved one into a ladies' room,
I had a funny
understand that. But just, I knew what was going through their head, and I said, if you would only know.
Yeah, I was with my mom at an advocacy group thing, and they asked about hygiene and bathing because that's one of the things that's very, very difficult. My father was, 230 pounds. My mom's, maybe $1.20 soaking wet. And she said, oh, I know how to do it. And she raised her hand. I'm like, oh, this is going to be good. What's she going to say? She goes, I just go in the shower with him. And I'm like, Mom. And she goes, honey, it's okay. I wear my swimsuit. I said, Mom, I don't care if you're naked in front of Dad. I care that you break a hip. You know, I'm like, that was when I realized we needed to have caregivers at home. I think, you know, seeing the humor in this is really important. So we've mentioned these brain healthy lifestyle changes. We'll make sure these are available to you. But you've heard them already from Beth and from Brooks. Avoid brain injury. Eat a balanced and healthy diet. Maintain your cardiovascular health. Challenge yourself. You know, learn something new. Participate in formal education at any age. Quit smoking. Schedule time for exercise. Stay socially engaged. This is why COVID has been so difficult for our elderly population. Treat depression and get quality sleep. This looks like a long list, but it's what you do for your heart is good for your head. Mm-hmm. The one caveat I will say here is that this is a pathological, progressive neurodegenerative disease. We will never blame someone for getting Alzheimer's disease. If it comes at you, you cannot blueberry your way out of Alzheimer's disease. But you can do things to make your brain more resilient, and I love Meryl's point about to keep yourself healthy until the science has caught up. And the good news is the science is catching up. So what else are we going to do, right? So what we can do. 13 million of us are living or caring for someone with Alzheimer's disease. We're at risk of unwinding all the progress we've made in gender diversity in the workplace. 20% of women are quitting work in order to care for someone with Alzheimer's disease. We have a Women's Leadership Council. Beth is now going to be joining it.
She is.
This is a group of women from all sectors around the world who've said enough is enough and are joining together and saying, we're going to look for ways to fix this. We bring women together. They are executive women, some executives, some not, but mostly executive women who said, we have a chance to change the face of our communities. And so if that's something that you're interested in participating in, we would love to welcome you into that. So I'm going to give each of the panelists an opportunity before we close to say, what's your pep talk for this group? You know, we've got a huge group of people online. We've got a group here who are probably going to grab you for questions after the session. But what's your pep talk for the group? Beth, do you have something you'd like to share with the group?
Yeah, absolutely. Please volunteer for research and encourage your friends and family members who it would make sense for to participate in research. We're not going to find the best treatment for everyone unless everyone is represented in the research that we do. So I hope you'll really consider that.
I would like to say that when women get together, we empower each other. So there is energy, especially when we're all together. But I want you to keep something in mind as a member of the older generation. We have a moment in time. Women are 50% of the workplace. We control over 60% of assets under management. We're responsible for 85% of consumer spending. That's over $11 trillion, and we drive the economy. We know what we have to do, and this is our moment in time because the window will close if we don't take it now. So I think this is the moment, and what a group to go with, right? Brooks?
Everything she just said. I would just say raise your voice and be an advocate. And you don't have to understand all the pathology of Alzheimer's in the brain. All you need to do is start the conversation. And I really would encourage everyone in this room and everyone that's listening to start the conversation with one person about brain health, because it's through our conversations and our storytelling and our advocacy that we really can change this disease. 20 years ago, heart disease was a disease of older men. Now in February, women across the world are wearing red dresses. And I think it's our time to stand up and say our brains matter, and we're gonna start those conversations. But it really does start with that first step. So I encourage everybody to advocate for our collective brain health.
And if you need guidance on how to have that conversation, mybrainguide.org is
There's
available
mat-
to you. There's
yeah,
materials
materials
here,
up here.
or
Yeah.
you can get online. And I think, for me, the biggest thing I would say is that we are at this innovation curve right now. I mean, Meryl's right. This is our time. Beth's right. Research is progressing. And so if we're going to do it, we're going to do it now. And Meryl has said to me on multiple occasions, I'm doing this for the next generation of women. Mm-hmm. I'm doing it so you don't have to quit your job to care for your mom or to care for your spouse. And so that's something we do for each other. That's something we do for our daughters. So it's really in our hands. So we'd like to leave you with one thought, which is let's take care of our brains so we can better take care of others, because behind every great woman is a great brain. So thank you for being with us today. You guys are great. Thank you.
It's fun. Let's take this on the road.